I unfortunately didn't get to experience a midwife take care of me, but I see during my time when I was having my kids, where it would have been a drastic difference, I think, in how I would have birthed my children. It wasn't a bad experience at all. It was actually great, but I think the biggest thing is what I tell my patients now is when you look at the difference between a midwife and an OB is we have exactly the same goal. We want a healthy mom and we want a healthy baby, but the way we go about it is completely different.
My first birth was with a friend who had a midwife, and I just saw how different that care was and how she had a relationship with this provider. She really trusted her, and I was immediately inspired and felt like it's just the most unique role I've ever seen in healthcare.
We are trained professionals who are, take care of women from when they start their period through menopause, especially during pregnancy.
I think one of the biggest differences between a nurse midwife and an obstetrician is time. We spend much more time during office visits explaining normal changes that are happening in their body, sensations that they're going to be feeling between now and their next appointment, a lot of guidance about healthy eating and exercise, and also about maximizing a woman's health and where she's at right now.
We do a lot of shared decision making, which is kind of another foundational point of our care, where we present all of the options to the patient, and most of them are evidence-based, and a lot of it's very important to their care, and then we help them make the decision that's the right decision for them.
One of the other things is that we are contracted with every insurance provider in this valley that all of our other physicians accept as well, and I think a lot of women worry about that, financially about care, and coming to Columbia Valley Community Health is a great place to come because we can work with women and their finances.
Obstetricians, they're specialized in pregnancy complications, and as nurse midwives, we specialize in normal, healthy pregnancies and some of the complications that often arise in those normal pregnancies.
Just to add one more thing that I always tell patients is that the midwife model of care sees pregnancy as a normal life event and not as an illness.
I like to tell women, whatever you choose, I will be there and I will support you. There's no wrong choice in how you choose to have your baby.
Mm-hmm. We want to individualize our care for what the specific woman needs to have that empowered and positive experience.
I think it's important for women to know that no matter what, though, you will have a midwife to be managing your labor. Obviously, if complications come up in your labor, sometimes an obstetrician does end up involved, but ultimately we guarantee that a midwife will be at your birth.
I believe in everybody that I work with, and I would let any of them deliver my baby if I were to do that again.
I've often sort of jokingly said that when we travel together through a pregnancy, at the very end of it all, we should feel like we're very good friends, that we know each other very well, and we should be able to hang out, go have a cup of coffee. We don't usually because we're busy working, but it really is about a relationship, and we've spent the time to build that with that woman, and then hopefully that relationship will continue on through the rest of her reproductive years and even into menopause.
And that's something that when people come in for their 6-week postpartum visit, it's very interesting because it's almost like you've been at a family reunion and now you're having to tell this person goodbye. Because it's been that way for me. You get very close relationships with these women and they feel the same way. A majority of them feel the same way. So that's when we get to share with them, if we hadn't during the pregnancy, that we can take care of you. We can keep taking care of you. You don't have to be pregnant for us to see you.
I remember when I was a patient seeing this group of midwives, and my husband, we walked out of an appointment and he goes, "It's like you just are hanging out with a friend. I love it." Because he's not a fan of going to, to the doctor's office. And I remember when he said that, and I was like, oh yeah, it's exactly like that. Yeah.